Hello, in this presentation, I'm going to share a few examples of Dural sinus thrombosis in children. These are cases we saw in the last couple of months. The first case is a 6-year-old child with Hodgkin's disease who presented with altered metastasis and hyponatremia, and we did the non-contrast HCT. Let's look at the axial images. We see that the superior cellular sinus is larger and more hyperdense than we expect. If we look at the coronal images, we see the same findings. Not only the density of the sinus is increased, it's also heterogeneously increased. Some parts of the sinus are more dense than other parts of the superior cellular sinus, and some veins also are bright than usual. And this child had a comparison study from 2 weeks earlier, which showed the expected density of the sinuses, which were normal in caliber, so there had been a change. So a Dural sinus thrombosis is suspected. We usually don't give contrast to confirm diagnosis. We do MR right away, but this was after hours, and the clinicians felt that we should kind of confirm diagnosis before we do an MR. So we gave contrast, and contrast enhanced CT showed that the superior cellular sinus did not enhance with contrast. We can see the enhancing cortical veins easily. And if you look at the other sinuses, such as the left transverse and sigmoid sinuses, there's no enhancement. Whereas on the other side, we see the normal enhancement of the right transverse and sigmoid sinuses. And as we follow it more inferiorly, the junction of the sigmoid sinus and interjugular vein is thrombosed, as is the cranial aspect of the left interjugular vein. So it would be in sinus thrombosis case. But how high a density should kind of bother us? We'll talk about that briefly. Before we do that, we did an MRI the following day, not to confirm diagnosis, but to look for parenchymal injury if there is some. We didn't see any parenchymal injuries, but while the child is in the magnet, we did do an MRV also, which showed absence of flow-related enhancement in the superior cellular sinus. And on the source images of this 2D time of flight MRV, we see the enlarged left transverse sinus without flow-related enhancement within it. So what density is abnormal? This is a paper from AJNR, now 14 years old. In this paper, they looked at the relationship between the hematocrit levels and the Hansfeld units of the sinuses, and there is a positive correlation between the hematocrit and density, as this line shows. But also, they identified a threshold of 70, positive 70 Hansfeld units to discriminate Dural sinus thrombosis from hemoconcentration. This is a study done both in children and adults, mostly adults. But in my experience, these numbers usually work. So if we go back and measure the density of the thrombosed superior cellular sinus, in this case, it is a little higher than 70 through 73. Well, that helps, but we don't just look at the density of the sinus. We should also look at the homogeneity of the density throughout the venous structures, and also the size of the Dural venous sinuses. So let's look another case. This was a case with trauma. As one can see, there's a left occipital scalp hematoma, and there is also a non-depressed fracture of the left occipital bone. Whenever we see a fracture of the occipital bone, we should always entertain the possibility of dural venous sinus injury. In this case, transverse sinus would be in jeopardy. Is this an extraaxial hematoma, or is this thrombus within the sinus? Hard to know definitively. This child also had some petechial hemorrhage of the left occipital pole. And again, this was after hours. They wanted us to do a CT venography, which we did, which shows that the porcula is normally enhancing, superior the sinus is intact. Is the normal right transverse sinus. We're going to go medially towards midline, torcula, and left side. See, the sinus is smaller. There is some thrombus from posteriorly, narrowing the lumen of the left transverse sinus and almost obliterating it. So this is an acute injury resulting in thrombosis of the left transverse sinus. Let's move on to the next case. This was a 3-year-old with acute lymphocytic leukemia. So posteriorly, the intensity of the specialized sinus looks normal, but if you look at it anteriorly on this non-contrast head CT, there's increased density, as we just mentioned. The density of the blood, normal blood, flowing blood should be homogeneous throughout the venous sinuses. Anteriorly, it's quite high, and not only the sinus is high in density, but the cerebral veins that are anterior are brighter, again suggestive of thrombosis. So we did an MRV on this child the same day, which shows lack of enhancement within the anterior aspect of the superior sagittal sinus, but the other dural venous sinuses, the posterior superior sagittal sinus, transverse sigmoid sinuses, and internal jugular veins are adequately patent. So it's important to look at the density of the sinuses throughout, not only in one part. The other thing we can and should do is utilize the conventional sequences. For instance, in this case, anteriorly, we see lack of normal signal void within the anterior aspect of the superior sagittal sinus. But if you look at other dural venous sinuses, the transverse sinuses show normal signal voids. This is obviously consistent with sinus thrombosis. And the last case, this child was scanned overnight, and there was a diagnosis of dural venous sinus thrombosis made at an outside institution, and the MRI and MRV were repeated, and the resident, probably biased by the outside report, thought that there was right-sided transverse and sigmoid sinus thrombosis, and the right IJ internal jugular vein was not visualized. And the thought was this was a dural venous sinus thrombosis, which would initiate anticoagulation. Granted, on the time of flight images to the time of flight MRV, it looks like it looks very asymmetrical, the venous sinuses. But if you look at the conventional images, let's look at the coronal T2-weighted images. We see the signal void of the left transverse sinus, which is the dominant side, and as we come posteriorly, we see normal flow throughout, but we don't see any sinus on the other side on the conventional images. So the sinuses are rarely symmetrical. Usually one side is larger, dominant than the other side. In this case, the right side of the dural venous sinus was either markedly hypoplastic or absent. As we discussed, acute dural venous sinus thrombosis will generate an enlargement of the sinus. It will, even if it's non-dominant, it will be a little bigger than normal, and we should always see some sinus to call it dural venous sinus thrombosis. So this was incorrectly thought to be dural venous sinus thrombosis. In fact, there was just a hypoplastic dural venous sinus on the right side. So we should always look at both the source images and the conventional images before we make a diagnosis. And that's it. Thank you very much for your attention.